you sabotaging your own happiness? The types of people who hold themselves back from getting what they want out of life. I've got a question for everybody. Who is holding you back from maybe getting everything you want in life? Could it be potentially you? Joining us this morning is Dr. Candace Seti. Good morning. You are the author of the Self-Sabotage Behavior Workbook, and we're happy to have you on the program.
Thank you. I'm happy to be here.
So let's talk a little bit about self-sabotaging behavior, because there are different forms, and you might not think you do it too much, but we're all guilty of doing it, right, at some point in our lives.
Yeah, pretty much everybody does it. And they don't even realize that a lot of the behaviors they're engaging in are forms of self-sabotage. We talk about things like procrastination or avoidance or overthinking or self-criticism, perfectionism. And we think these are just kind of behavioral descriptors, but really they cause behaviors that ultimately prevent us from achieving our goals or getting what we want in life. So they ultimately are forms of self-sabotage that most people engage in.
So let's say you are a procrastinator, or maybe you are an overthinker. How do you kind of get out of that mindset and understand some of your triggers?
Well, I mean, like you said, when you talk about understanding your triggers, you really need to pay attention to it and see not just the behaviors you're engaging in, but how they are potentially standing in your way. And you can't do that unless you know what you want, unless you know what you're trying to achieve. So the first step is really to identify your goals and really think through what it is you want and why you want it, not just the fact that you want it. And when you get a good understanding of that, then you can start to look at your behavior and say, is this behavior helping me move towards that goal or moving me further away from that goal? And that understanding allows you to really learn more about your own particular behaviors. And from that, then you can start to challenge those behaviors.
So do you have any mental exercises that we can do? Because I'll admit it, especially during the pandemic, you have a lot of negative thoughts, and it's hard sometimes to get out of that negativity in your brain. So what can we be doing on a daily basis to hopefully kind of transition out of that negative mindset?
Well, a lot of the negative thoughts are not based in reality. They're not based in facts and data. When we talk down to ourselves or we beat ourselves up, we're not really doing it based on things that have happened. We're doing it based on fears. So I encourage people to look at the facts and the data, look at the truths. What can you say to yourself that actually is positive, that is based on reality? How can you talk to yourself like a friend? How can you be kind to yourself and say things that are nicer, and maybe start your day every day and end your day every day by focusing on the positive and looking at the good things in your life and the things you've done well and the ways that you can pat yourself on the back and really start to retrain your brain to really focus on these positive things.
Is this a long process? Are we able to train our brain over a couple of weeks or a couple of months?
Absolutely,
yeah?
absolutely.
Okay.
Yeah, yeah.
Well, that's a good thing, because I think a lot of us have had some icky thoughts that we want to get rid of. So lastly, we've got 30 seconds left. What is your final message to folks out there about conquering their dreams and overcoming their fears and those negative thoughts?
Well, just like anything else, self-sabotage is habitual. I mean, it's habit-based. So if you were to stop biting your nails or stop smoking, you're breaking a habit. And it takes time, it takes dedication, it takes commitment. But every day that you have success, you're that much closer to achieving what you want to achieve. So I tell people to keep at it and really understand that what they're doing is breaking habits. So it does take some time. They do need to be a little patient with themselves.
Give yourself some grace and some time. Dr. Candace Seti, we appreciate your time this morning. Thanks for joining us.
Thank you.